Hello doctor. Once again I welcome you all on MIT series on my channel Dr. Asad. So today there will be third video in this series, MIT series, and the subject will be anesthesia. Guys, if we talk about overview about anesthesia, then there will be 4 or 5 marks from this subject, but this subject also correlate with some other clinical subject like medicine, surgery, or like any emergency cases. So for that you have to study this subject, and I can say it's easy. Like you can score full marks from anesthesia. It's depend on you from where you're what topic you are studying. So for that, let me start with medications, like which preparation are using nowadays, like most important for this exam. Now there are 3 subcategory: IV anesthesia, then local anesthesia, inhalational. So let's start your study with IV anesthesia, because they are asking every exam propofol, ketamine, thiopentone. So you should also start with this because they are asking. So start with this, so you will be like very clean about this topic. So first medicines or first preparation in this IV is study propofol. Guys, last 2 or 3 exam they are asking propofol. In every exam they are asking like what preparation, everything. Just say simply study, read everything about propofol. Then the second will be ketamine, and the third is thiopentone. These 3 at least you should study from IV. Then the second will be like local anesthesia. Guys, local anesthesia you should know what is amide, what is ester. So difference between, you have to differentiate in both. You should know the name of these, and what all medications come in esters and what all medications come in amide. Then one more thing, like nowadays they are very useful, so that's why they are asking like labor anesthesia or epidural anesthesia. Now because they are using labor anesthesia, local anesthesia in labor, for just because they want to intact power and they want to remove the pain. So for this it's very useful. So just go and study with study about local anesthesia in detail. Then the toxicity of local anesthesia, you should know what toxicity are there. Then you should know the ester, cocaine, everything, like especially cocaine you should know, because they are asking correlate with FMT, forensic medicine. Now these are about local anesthesia. Third one is inhalational. In inhalational also you should know the important 3 or 4 medications like isoflurane, sevoflurane, desflurane, and halothane. Most important is N2O. Like in last exam they ask about N2O. These were about medications, like what in emergency cases they are using, which is daycare surgery, drug of choice for daycare surgery, drug of choice for cardiology, drug of choice for neurology. So these all you will be like, तुम्हें इसमें मिल जाएगा, आप लोगों को इसमें मिल जाएगा प्रोपोफॉल किसके लिए है और वो किसके लिए. इनफ है इतना मेडिकेशंस के लिए. Now we go further, like you should know the spinal anesthesia. I mean guys, for this you should know the location in children, like in children L4, L5, in adult L3, L4 we have to proceed. So you should know the location of this. Then the one more topic are there which is also important. You should know the drug which trigger malignant hyperthermia. So guys, you should know everything about malignant hyperthermia. Because this link with it's going to link with other subject. Malignant hyperthermia also you have to study in medicine, so study here also. Then you should know the lumbar puncture. Guys, again one more important topic, lumbar puncture, which layer in from outside to inside, you can say, or from starting to end, which all organ piercing, like skin, then subcutaneous tissue. So you should know the all 7 or 8 I think are there which you are going to pierce while giving lumbar puncture. So then again guys, these were the important. Two or three more important topic are there, like you should know the obviously very important color coding for or pin index, cylinder color coding and pin index. These 2 are important, like N2O cylinder का कैसा color रहता है, Antonox को कैसा color रहता है, then pin index. For all these things you should know. I think it's very easy, or everywhere you will get. There are many mnemonics. I will also going to give you like mnemonic for these things and many things. Then the correct placements of, you should know the correct placement of ETT, endotracheal tube. Guys, like there is procedure called C type. You should hold this and flex neck. These things you should know everything about how to like give endotracheal position for endotracheal tube. Then the correct placement, how you should know the flail chest, like chest will be while breathing it will be inflamed. Then many things are there, so you study with about this. Then two topics are there, airway assessment and airway equipment. Guys, nowadays as you know, they are giving images, so every year from anesthesia at least one image they are giving. So and that also come from airway equipment. There are 4 or 5 equipment like face mask, airway equipment में आता है anatomical face masks, then LMA, these things like 5 or 6 equipment are there. So you should know the equipment and their images you should know. So guys, these were the important topic. Again, from most important to least important, study with propofol, ketamine, thiopenton, then isoflurane, sevoflurane, these are the medication. Then the ester amide के बारे में, कौन सा एस्टर में आता है, कौन सा amide में आता है. Then these इस सब का like toxicity, especially local anesthesia का. Then labor pain में कौन सा anesthesia यूज होता है. Then the again color coding for cylinder and pin index. After that, there is important also airway assessment, airway equipment. Airway assessment means you have to examine the patient before giving anesthesia. For that also, like one more thing they are asking nowadays, spinal anesthesia contraindication. What all the contraindication of spinal anesthesia. Then how you have to make patient prepare for anesthesia. These things very important. I think guys, you should study. If you will study 5 or 7 hours anesthesia, it will be enough for revision. And from now, revise 2 or 3 times till exam. So overall 14 hours you can revise, and these 5 to 6 marks are achievable. So guys, study anesthesia carefully. Whatever notes you are following, go through that. And guys, now again I'm saying, every day I'm saying this thing, be positive, don't be in hurry, don't be in panic now. Just relax and study. The most important, very important point which I'm going to tell you all, that guys, increase number of hours. As soon as you will increase your number of hour, you will get confident. Minimum 14 to 16 hour padho, and guys, trust me, you are going to blast in your exam. So guys, be patient, be relaxed, be calm, and study hard. Thank you and all the best. And again guys, please subscribe the channel if you haven't subscribed till now, and like also.